Good morning, everybody out there. This is Morgan Denny coming to you live for the PT on Ice Daily Show. It is a beautiful Tuesday morning. Actually, I'm not sure. The sun hasn't come up yet on the West Coast, but I'm sure it's going to be. So before we get started today, I just want to do a quick course update for the month of August because yes, it is already August, believe it or not. Next weekend, Eric Chaconis is doing the extremity management course in California in lovely Santa Barbara. And following that, cervical spine will be happening in Connecticut. Justin will be teaching total spine thrust in Wyoming. And the next weekend, last weekend of August, semi-last weekend of August, modern management of the older adult is going to be happening in California also. So if you are in any of those areas and you want to check out some of those classes, get on over there. So without further ado, this morning I want to talk about treating the gender-neutral patient. So as many of you, and hopefully all of you are aware, some people do not identify with the masculine or feminine he or she. They identify with the gender-neutral terms and prefer to use those because it helps them feel more themselves. So they use pronouns that are they, them, theirs, or ze, or here, or many other pronouns that may be new to some of us, right? But in figuring out who wants to use these gender-neutral pronouns, it's really imperative for us to figure out who is actually comfortable there, right? But it can be really difficult as clinicians or as people to know who to ask, right? Like who do we ask who wants to use a gender-neutral pronoun? Not only that, but it can be kind of uncomfortable for people. So one of the suggestions I have is that, and one of the things that I feel is actually imperative right now, is to have a pronoun section on your intake form at work. So here's another suggestion. It should not say preferred pronoun because the word preferred indicates that that is a choice versus just their identity. So it needs to just say pronoun so that they can indicate if they have a pronoun different than he or she, her, hers, all of these things, right? Now, it also makes it a spot that opens up kind of the conversation for the person, or at least allows them to know that there's the space for them to have their preferred or their pronoun used. So see, I just said preferred pronoun, which is a mistake, but one that I'm trying to work on because that's a habit that I have. We're all going to make mistakes and that's okay, but it's really imperative for us as clinicians and as people in society to really be able to step up and start using the more appropriate pronoun for people, right? So having that spot on your intake form is good because it opens up the space that people know that it's safe for them to use their preferred pronoun, not preferred. It's safe for them to use their pronoun and that people around them will be using their pronoun as well. So having that spot just kind of opens things up. And then also allows you to be able to know who to use a gender-neutral pronoun with instead of needing to try to figure out who to ask or feeling uncomfortable about it. So when you know that someone has a gender-neutral pronoun, it's important to use that pronoun in all forms of communication, right? When you're one-on-one with that person and you're in the room, it's not going to be super difficult because the pronoun you're most commonly using is you. But when you are communicating with an aide or an assistant in the gym or with staff, you need to make sure that you use the person's appropriate pronoun. Not only that, but when you are documenting about the person, just because you're documenting doesn't mean that it's appropriate to go back to using he or she or whatever you think is the appropriate pronoun. You need to be able to use the pronoun that your patient wants you to use. Okay? Not only that, but if your patient is going to be coming into contact with other people in your office, right? So scheduling at the front desk, or if they're going to be working with an aide or an assistant in the gym, or anything like that, you need to make sure as the clinician that you let those people know that your patient would prefer to use they, them, theirs, or ze, or anything else, whatever the pronoun is that they identify with. Right? Like as clinicians, it's our job to make people feel comfortable, to make people feel like they can be themselves, and to allow people a space that they feel safe. And part of that, if you are a gender-neutral person, is to have someone be able to use your pronoun appropriately instead of kind of glossing over it like it's not a big deal. And when you have that spot on your form and when people within the clinic all address you and talk about you appropriately, that's a big deal. It's a big deal. So it's something that we need to really step up and do as clinicians, as healthcare professionals in general. Now, you're going to make a mistake and that's okay, right? Like we all make mistakes. For example, earlier I said preferred pronoun when I meant to say pronoun. But that's a mistake that I'm working on, which is why I corrected myself on live TV. Anyhow, but we need to make sure if we make a mistake in front of the patient or even just in front of our staff that we apologize, use the correct pronoun, and then move forward, right? Don't gloss over it. Don't pretend you didn't notice. Don't pretend they didn't notice because they definitely did. But if you gloss over it and just move forward like you didn't notice, it's disrespectful to the patient. And it's either showing that you don't care enough to make the effort to address them appropriately, or it's showing that you don't respect their choice. And either one is really not appropriate and unacceptable from a healthcare professional in general. So we need to make sure that if we make mistakes, which is going to happen and that's okay, that we just apologize, replace the pronoun with the correct pronoun, and then move forward. If you're having trouble using they, them, theirs, or the correct pronoun that your patient wants you to use, then just use their name. Like make an effort to use their name so that you don't fall into needing to use a pronoun or needing to apologize too frequently, right? Now, I mean, gender neutral people are going to understand that some of these things are newer as a society and that we're working on it. If they have a pronoun that you're unsure of, so if your patient comes in and is marked here, spelled H-I-R on their intake form under the spot pronoun, and you're unsure of how to use it, it's okay to ask, right? Like if you don't ask and you don't use their pronoun or you don't use it appropriately, that may seem more disrespectful. But if the person comes in and you say to them, I see that you marked this pronoun, and if you don't know how to say it, you don't have to. I see that you marked this pronoun on your intake form. I'm not very familiar with this. Can you help me in understanding when to use it? And will you please correct me if I use it inappropriately or don't use it? That really allows them the space to kind of help to coach you without feeling uncomfortable about it or without feeling like they're having to initiate. Because if you think about it, it's like as patients coming in, people are really vulnerable. They're not only having to expose a body part, show you how they move, show you their body, they're having to discuss their lifestyle and lifestyle factors with you, what exercise they do or don't do, what they eat, all of those things. You're not having to expose anything. You're not vulnerable as a clinician, but your patient is. So if you add an extra step to that, if you add them having to correct you all the time using the inappropriate pronoun, that's hard on them as patients. So it's important that we step up and we kind of like give them the openness and the space to correct us, to help us to understand without making it their job, if you know what I mean. So remember, if you make a mistake or if you need help, that's okay. Now another point to make is if you have a gender neutral patient who has had procedures, medical stuff that has to do with their gender identity, it's not always appropriate to ask questions about these, right? Like it's really private information for these people. So a good rule of thumb to kind of understand if it is or is not appropriate to ask a patient a question about these things is to ask yourself, is knowing the answer to this question going to change the effectiveness or the safety of my treatment, right? So if having the answer to that question could dramatically change what you do in PT, then it's probably appropriate to ask. Now that doesn't mean that you can ask them details about a surgery or procedure or why, right? But for example, if someone has had top affirming surgery, right? They may have scars around their anterior ribs and breasts, but if they're coming in for an ankle sprain, it's definitely not appropriate for you to ask, right? Like that's not okay. But if they're coming in with shoulder or thoracic or cervical pain, something that could be affected by scar tissue anteriorly decreasing the thoracic spine extension, then yeah, it's probably important for you to ask. Now that doesn't mean you get to ask them why they chose to have that surgery. That's still off the table. But it does open up the ability for you to ask about the surgery, making sure that your patient understands why you're asking, right? And then if the patient is comfortable, that also means that you're probably going to need to evaluate and assess that area to see if there's scar tissue, to see if there is something that you might need to work on as a PT. Now, the last piece that I want to share is kind of a lesson that I've learned from my gender neutral patients and friends. And that is that people who are gender neutral are often up against a lot in society, right? They're a community that is too often threatened and has hate crimes committed against them. And so as people in society living their true selves, it is often very stressful, and they often may have some fear or some anxiety, like leaving their house can be difficult, can increase their stress level. So it's important for us as clinicians to understand where they may be coming from. Now, that doesn't mean that everyone who identifies as gender neutral is going to be stressed out or anxious or a fearful person, not at all. But it does mean that we need to understand as clinicians that anxiety, that level of stress may be playing into some of their symptoms. You know, as we become better at clinicians and better at understanding pain especially, we know how much stress plays in, right? And if people are stressed all the time because they are living in communities that don't support them, or if their workplace doesn't support them and they don't feel comfortable with themselves there, then that can be a player in some of these symptoms. So we need to be comfortable as doctors of physical therapy in asking the question, in saying to the patient, you know, do you feel like stress or anxiety or fear play into your symptoms at all? People will know. They'll be able to tell you, yeah, I think so, or yeah, when I'm stressed, I notice this, or yeah, it's only when I'm in my workplace that I really feel my symptoms, jump up. And I mean, we know that a lot of people get stressed out at work because sometimes work's not fun, but there can be a lot of underplaying issues. So as their doctors, as their treating clinician, we need to be able to identify some of these things and be aware that they could play in a little bit differently with some of our other patients. So we need to be able to step up and at least ask the question. And then if our patients have stress, fear, and anxiety on board in ways that we are not treating, we need to be able to refer them out, right? To get them the resources they need so that they can feel more comfortable or know how to manage their stress. So that's what I've got for you today on the gender neutral patient. As a reminder, please, 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 everyone, make sure your intake form has a spot that says pronoun. Even if lots of your patients don't use it or fill it out or understand what it's for, if you have a patient that comes in that identifies as gender neutral, they will know and they will appreciate it, and it will change your treatment. If you have questions about treating the gender neutral patient, especially if they are questions that are inappropriate for your patient, please feel free to message me. I will happily answer any questions I can so that we can treat better, right? So that we can step up and be those clinicians that help this community. So without further ado, the song of the day is Respect. It's not the version by Aretha Franklin or the redo by Otis Redding, although those are both really great. It is the one by Train, and I'll post it below on the Facebook page. All right, people, have a great day, and let's just be the best clinicians we can be.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.